A vaccine cheaper than slippers. The truth of Adar Poonawala in front of the vaccine industry. Hello, friends. Have you ever thought that the vaccine manufacturers themselves do not have the right to set the price of the vaccine that we take for our safety? Can you imagine that such a life saving drug, which has saved millions of lives, can be cheaper than the shoes sold on the roadside? This shocking truth came to light recently in Davos when Adar Poonawalla, CEO of the Serum Institute of India, revealed how many challenges the vaccine industry is going through. He clarified that the freedom to fix the price is necessary for the advancement of this industry because neither research is possible nor the creation of new jobs without proper profit. If this situation continues, the pace of innovation and new vaccine development in this sector may slow down in the future. Today, we will discuss this topic in depth. But before that, if you are new to our channel, please don't forget to subscribe to the channel so that you will be the first to get our new video updates. So let's start today's discussion without any delay. Adar Poonawalla made it clear that there is no need for exemption or promotion of the vaccine sector, but relief from excessive price control. He argued that many vaccines cost less than cheap street shoes or slippers, which is a big problem for the industry. He also said that if a vaccine is sold for 300 to 400 rupees, then there is nothing wrong in it. But forced control of prices by the government and other institutions can hinder the development of this entire sector. He also said that vaccine companies should be given the freedom to set prices based on their costs and profits so that they can invest in research and development. Poonawalla presented another important comparison with the vaccine industry. He said that while sectors like IT, auto, and finance earn billions of profits every year, the vaccine industry can hardly earn even 1 billion rupees in a year. This fact shows that this sector is not making enough profit despite its full potential. He clarified that if this industry also gets proper freedom like other sectors, then it can also grow rapidly. But currently, when vaccine prices are kept very low and the government or other agencies set their prices, companies do not have enough resources to increase new research and production. As a result, the future of this industry may be in jeopardy, and it may be difficult to develop new, improved, and more effective vaccines for future generations. Apart from this, another important point that Adar Poonawalla raised was the issue of profits associated with vaccine manufacturing. He said that if a company will not be able to make money in this sector, then it will be unable to invest again and develop a new vaccine. As a result, next generation vaccines and medicines will not be developed in time, which will harm the entire world. He gave an example and said that if India wants to stand at par with global giants like Pfizer and GSK, the vaccine industry should also get a proper opportunity. He also said that these companies are worth 100 to 200 billion dollars, while Indian vaccine companies are struggling to cross the $1 billion mark. Apart from this, Adar Poonawalla also ruled out the possibility of going public with Serum Institute soon. He presented another aspect of this whole problem, which is related to research and development. The biggest challenge in vaccine development is that developing effective vaccines against new diseases and viruses requires huge amounts of capital and resources. Poonawalla said that unless governments and policymakers give the sector the freedom to set the right price, it will be difficult to invest in new and more effective vaccines. He gave an example and explained how vaccine companies of developed countries get huge grants and support from governments, while Indian companies have to struggle alone in the market competition. This situation not only slows down the development of the local industry, but also affects India's competitive ability at the global level. He said that currently, due to price control, vaccine companies cannot be listed. Even if their sales and volume increase, but if the profit is limited to 10 to 15%, then investors will question the valuation of the company. He further said that if in the future, after 5 to 10 years, the position of the industry becomes stronger and the company will have multiple revenue streams, then listing can be considered. He also added that as long as the government keeps the prices of vaccines artificially limited, it will be difficult for this industry to remain competitive at the global level. In this whole discussion, an important question also arises. Should companies be allowed to increase the prices of life-saving drugs? Do people have to understand that if the companies do not get proper benefits, then how will they do research on new drugs? This whole debate is not only limited to the vaccine industry, but it is a big issue related to the entire healthcare sector. If Adar Poonawala's thoughts are seen deeply, then it is understood that the vaccine industry needs freedom to grow like other industries. Governments and policymakers should consider how to make this industry more financially viable so that it can manufacture new and more effective products. However, this issue cannot be seen only from a business perspective, but it is also a social and health issue. If the vaccine companies do not get the right to set the right price, they will not be able to invest in new research, and this will directly affect the health services of millions of people. Poonawalla rightly said that no industry can progress without profit, and this industry is no exception. The impact of decisions related to this will not be limited only to companies, but it will also affect global public health. Finally, the question is whether the government and other policy institutions will take this issue seriously. Will vaccine companies be given the freedom to make profits so they can invest in research and development? This debate can continue for a long time, but one thing is clear. If we want an effective and safe vaccine in the future, then this industry should also be allowed to set the price of its products. Without it, not only the development of companies will stop, but the global health system can also be affected. Therefore, it is necessary that governments and regulatory bodies give priority to this issue and make such policies which can strengthen this industry. If you like our content and want to make our efforts even stronger, you can support us through the QR code given in the video or the UPI ID given in the description. Your every small contribution is valuable to us and will inspire us to make even better and informative videos. Your support is our strength. Also, if this video taught you something new or you felt that this information should reach others as well, then do not forget to like and share the video. If you have any questions or suggestions in mind, then do let us know in the comments. We look forward to answering your every question and listening to suggestions. And yes, if you want to stay updated with our every new video in the future, then subscribe to the channel and press the bell icon so that you get every new information first. GRT Business always strives to give you accurate and reliable information. Our news is obtained from various news agencies, public opinion, and public sources. We try our best to verify every report, but we are not responsible for any dispute or error. Our sole aim is to provide you with accurate and reliable information.